Since Monday, the Pan American Health Organization has been facilitating a training on emergency care and treatment for first responders at the Biltmore Plaza in Belize City. Over the years, there have been disjointed responses to emergencies, and the workshop seeks to bring together all agencies that respond to emergencies in an effort to preserve lives. The training will standardize the process across first responders.
This is basically an interagency work that we're trying to gather and have a little bit more of the capacity that is required when we have to provide that life-saving measures. Not just on the hospital, but also when we are on site, on the road, and so on.
So the sessions are practical and theoretical?
It is very practical. You should come you should come later on and see that. You will see some of the participants trying to practice what they've learned. For example, yesterday we have done some bandaging, how to lift patients, how to immobilize patients. This afternoon we'll be doing some splinting and caring for wounds and so on.
A key stakeholder is the Ministry of Health, which provides personnel from across the country with updated training on emergency care procedures, specifically needed during times of disasters. Coupled with the services of the emergency medical technicians from birth and the like, Principal Public Health Inspector says that first responders are key to the survival of victims in times of accidents, fires, and even mass casualty events.
For this year, we had a number of trainings slated. We started with the mass casualty management training. We had the incident command system, and now we're having emergency care and treatment. In terms of disaster, the Ministry of Health is always responsible to ensure that the cadre of staff or people who respond to disaster as it relates to health are trained and have the specialized skills. Critical to the entire process is that in most major emergencies that we've had, people have been working in isolation. So the police would respond, the fire would be respond, but then they start tripping over each other because, they have not been used to responding in a coordinated fashion. And so we need to ensure that everybody is clear in terms of their roles and responsibilities as it pertains to disaster management.
The training shows the shortfalls in terms of coordination among agencies. While the National Emergency Management Organization is the coordinating arm within government in times of disasters, John Bowden says that there is the need for a central response system.
A central response system which combines all the different agencies together to respond to the emergency. So we should be seeing more often people responding as a joint agency and not necessarily independently.
I think the committee exists already at the national level. It just needs to be strengthened, and I think there's always room for improvement, for coordination. And I think Belize is on a good track in that sense.
Duane, Moody for News 5.